All right, it's 12:01, so let's go ahead and get started with this webinar. Good afternoon, everyone. Thank you for joining us today. The title of today's webinar is The Connection Between Oral Health and Overall Health. My name is Cassie Murphy, and I will help facilitate today's webinar. Today's presenters are Dr. Nina Prabhu and Dr. Eileen Crespo. Dr. Nina is the Chief Dental Officer here at Delta Dental, and Dr. Eileen is the Vice President of Medical Services here at Delta Dental and a practicing pediatrician for over 20 years. Dr. Bruce Templeton will also join us at the end for our question and answer session. Dr. Templeton is an oral surgeon and has served on the board and as a medical consultant for Delta Dental since 2011. We are fortunate to have all of these clinicians on staff here at Delta Dental of Minnesota. They are experts in their field and the key contributors to our very own The Power of Smile blog. This blog is located on the Delta Dental website, and it's where you're going to find even more information on oral health topics. Today's presentation will last approximately 30 minutes with time at the end for questions. You should see a Q&A button at the bottom of your screen. So at any time during the presentation, if you have a question, simply send it through the Q&A, and our clinicians will be here to answer those questions at the end. In addition, when the webinar is complete at 12:45, you're going to receive a short survey. Please take a minute to complete this. This information will help us plan for future Lunch and Learn oral health webinars. Also, as a reminder, this webinar is being recorded. So thanks again for joining us today. And now I will hand it over to Dr. Nina.
Thank you, Cassie. Again, thank you everyone for joining us this afternoon. We're going to start right away into our topics. We have a lot of ground to cover. So what is oral health? Definition and diseases. As we talk about oral health, when I started dental school, back quite a few years ago, we defined dentistry. We defined dentistry as prevention, diagnosis, and treatment of diseases of the teeth and the surrounding structures. When in 2016, the Dental Federation, World Dental Federation, redefined oral health. And it is now multifaceted and all-encompassing. As you can see, it covers speaking, smiling, teeth. It covers the orofacial complex, or as we talk about, the head and neck. So in short, oral health is a lot more than just your teeth. Let's talk about the diseases. There's common diseases of the mouth and supporting structures that we talk about when we talk about oral health. So the number one is tooth decay or cavities. Periodontal gum disease, oral cancer, oral manifestations of HIV, orodental trauma, and now you see that very common in children and adolescents as they do their sports, and birth defects such as cleft lip and cleft palate. So what is the impact and effects of some of these chronic diseases that affect children? So what is the number one chronic disease that affects American children today? It is actually cavities, also known as caries or tooth decay. So if you look at the statistics, it is very alarming. 1 out of 5 children aged 5 to 11 have at least one untreated tooth with a cavity. 1 of 7 adolescents aged 12 to 19 have at least one untreated decayed tooth. Children who are from low-income families have a higher preponderance for cavities. If you look at all these statistics, it is extremely alarming that in the United States currently, this is one of the most chronic diseases that affects children. Now, we all know, this is a little bit more statistics. But we all talk about childhood obesity, asthma, hay fever, and diabetes in children. But what we don't talk about is that caries in teeth or decayed teeth have a higher incidence in children than some of the ones that we more commonly talk about. Now, when we talk about this, what is the impact? Well, here we go. How does it impact children? Children with poor oral health are 3 times more likely to miss school because of dental pain. Statistics say there's 51 million school hours lost every year. Now, what happens with decayed teeth? Well, the infection tends to spread. So children will have dental abscesses, they have pain. And some of these translate to disease as you grow into young adults and adults. So you will have increased lifelong dental needs. Now, decreased lifetime earnings. Well, if you think about oral disease in children and missing school hours, well, when it translates to adults, it loses its loss of work hours and can impact your lifetime earnings. And unfortunately, the last one, we do see death in children due to the spread of infection and dental abscesses. Oral health in adults, it is estimated that approximately 3.5 billion people worldwide have some oral disease. If you look at the world population, that's about 45%. That is 1 in 2. If you're looking at 5 people in the panel here, half of us have some oral disease, which is astronomical if you think of the numbers. Untreated cavities in permanent teeth are the most common health condition in the world currently due from the Global Burden of Disease study that was done in 2019. So it's fairly recent study. Some of these studies don't come out very often, but this is a fairly recent study. Approximately 14% of the global adult population has gum disease or periodontal disease. Oral cancer, again, is very common in adults, much more common in some countries in the Far East, but it's still very common cancer that affects adults. Factors contributing to oral health of adults: unhealthy diet, high in sugar, use of tobacco, alcohol consumption. And when we talk about alcohol consumption, we're talking about excessive consumption. One thing that is very positive in this conversation is that most oral health conditions are largely preventable and can be treated in their early stages. Now, we all talk about why is it important to prevent oral disease? Well, I'm going to hand it over to Dr. Crespo now to talk about the next connections.
Thank you, Dr. Nina. It's a great foundation. We're going to talk a little bit more about the multiple relationships there are with your oral health and your overall health. So we know that oral health is a key indicator of your overall health, your well-being, and your quality of life. If you have any doubt about this, talk to anyone who's had a toothache, and they will let you know how much that impacts their life. And that includes young children, as Dr. Nina has just talked about, kids missing school, kids unable to sleep because of the tremendous pain that comes with an untreated cavitated tooth. We know that actually more than 120 medical conditions can have findings in the mouth and oral cavity. And as Dr. Nina has already alluded to, your oral health isn't just your teeth, it's everything else in the oral cavity. And when you are going for your regular dental visits and you're getting a complete oral exam by your dental provider, they are looking for all signs that can be found, looking at your teeth, looking at the gums, looking at your tongue, looking underneath your tongue, and looking in the back of your mouth and throat, kind of where your tonsils are, looking for any abnormal findings. And that's why having those routine visits is just so important. This slide is busy. I'm going to try to walk you through it. We're going to start, really, these are specific linkages with your mouth and your body, starting in the upper left-hand corner there with lungs, that there are particular types of bacteria that are found in your mouth that are oftentimes the ones that cause cavities. Those bacteria have been found in lungs and in patients typically who are ill or on breathing machines or ventilators. And we know that obviously those connections are there. So those bacteria come from the mouth and get down into the lungs and can cause pneumonia. Bones, we know that bone density decreases with age, and that includes all the bones in your body. As you may be familiar with, there is increased risk for hip fractures in older people, but those same bones that weaken include the bones around your teeth. And as those weaken, your teeth can become loose and fall out. Oral cancers, as we've talked about a little bit, can develop. Again, early signs detected by your dental provider can help prevent the spread, and diagnosis early is just so important. Pregnancy is a fascinating physiological time where there are hormone level changes that can cause some pregnant people to develop gingivitis. The brain and really your mental health has a lot of connections with your oral health. We know that there are hormones produced during times of stress and with conditions like depression that can contribute to developing gum disease. There are fascinating connections between gum disease and cardiac health, including the risk of stroke. Kidney disease, there are some linkages there as well between kidney disease and oral health problems. And then for diabetes, which we're going to get into a little bit more in a future slide, there are very clear connections between gum health and diabetes, either diagnosis and or control of diabetes. So I think the Surgeon General's report that was published in 2000 called Oral Health in America really shone a spotlight on the tremendous connections that there are between your oral health and your overall health. He wrote there that oral diseases and disorders affect your general health and well-being throughout life, that unfortunately profound oral health disparities exist in the US, and that your mouth is a reflection of your general health and well-being. And most importantly, and something that we're going to continue to repeat today, is that safe and effective measures can prevent most dental diseases. So this is a little bit more about pregnancy here. We know that 1 in 4 people of childbearing age have untreated cavities. Children who are cared for by people with untreated cavities have a higher risk of developing dental disease themselves. Dental care is safe at any stage of pregnancy. I think that's a really important point here today. And that pregnant people are encouraged to seek dental care during their pregnancy. No need to skip dental visits or x-rays when you're pregnant. Actually, it's the time to really focus on maintaining good oral health. A variety of organizations have tried to develop educational materials to really get this information out there. This is a resource provided from the American Academy of Pediatrics. And although the print is small, you can see on the top of that banner that it really starts again before you become pregnant, and certainly during your pregnancy, that you care for your own oral health by having a daily routine of brushing, flossing, and getting those regular visits. When that baby is born, to actually start doing oral cares right away, and that means either using a moist washcloth or a small moist gauze that you can wipe the gums after feedings. Once that little tooth erupts there at the 6 to 12 month age group, to go ahead and start brushing using a fluoride containing toothpaste twice a day, and trying to choose healthy foods that don't have added sugars for those little ones. And then on the bottom of that banner there, most important is to get that child to a dentist by their first birthday. I do think there's a lot of myths and misinformation that baby teeth are not important and that you can wait until your child goes to kindergarten before they go to the dentist. And we know that not to be true. And we know that a healthy start begins really, again, during the pregnancy and immediately afterward. This is a little bit more here about diabetes and oral health. And again, this is a very interesting bidirectional relationship that has been found. So periodontal disease can cause pain, persistent bad breath, chewing difficulties, and even tooth loss. And having diabetes slows down healing, so that if you have periodontal disease and diabetes, those treatments to get your gums into good condition are so important. We know that untreated gum disease can make it harder to control blood sugar, and uncontrolled blood sugar can have ramifications in your overall health. So you see that all of these things are intertwined with maintaining good gum health, and if you have diabetes, really maintaining good control of your sugars. This is just a quick comment about COVID-19 and periodontal disease. There have been some studies finding that periodontal disease can be a risk factor for COVID-19 complications, and then maintaining good oral health, including healthy teeth and gums, can help be somewhat protective against the inflammatory response of COVID-19 infection. So the bottom line here, your oral health is of course part of your overall health. And now I'm going to hand it back to Dr. Nina, who's going to take us through the next part of the presentation.
Thank you, Dr. Crespo. Now that we've given you all the news about the statistics of your oral health, how it's connected to your overall health, well, we want to leave you with some information and what is the solution? This is all preventable. So here are a few key factors that help you improve your oral health: healthy habits, nutrition-rich diet, and early detection. Now, as oral health experts, and even Dr. Crespo, who starts very early with the children, we all help in the early detection and helping you in getting better treatment once we've identified it. But most of it is in your hands as a patient, as a member, to take care of your oral health. So let's start with our healthy habits. How often and how long should I brush? This is an age-old question. We get this all the time. Dr. Templeton and I get this frequently when we go out in the community. So the consensus for people to brush their teeth 2 minutes twice a day. So 2 minutes twice a day. It takes 4 minutes out of your long day to do this task. Replace toothbrushes every 3 to 4 months or more often if the bristles are visibly matted or frayed. Now, one of the things that we remind people is use soft bristle brushes. But if you are replacing your brush more often than 3 to 4 months, what do you think? There's something wrong with probably the way you're brushing. So the next time you go talk to your dentist, ask them, what am I doing? Because my brush is getting frayed every month. So as a consumer, be aware of what we are recommending, but how does it impact you personally? What type of toothbrush should I use? Either manual or electrically powered. I have a favor towards manual. That's my personal preference. Dr. Crespo and I've talked about this quite heavily, and she loves her manual toothbrush. Everyone has a personal choice, as long as you do it 2 minutes twice a day. So medium to bristles, some people think that helps clean their teeth better. It does take away the biofilm on the teeth. However, medium bristles tend to give you the higher risk of gingival abrasion. So we recommend soft. Electric toothbrushes, both manual and powered toothbrushes, are just as effective at removing plaque. While the powered toothbrushes can be expensive, some people have a preference. From a recommendation or who it helps, a powered toothbrush may work better for people who have dexterity problems, like the elderly, people with disabilities. That's where they come in very handy. I do love these for my children. Gives them the 2-minute timer. It gets them excited about brushing their teeth because it's powered. Most children love anything that has batteries in them. That was my personal experience from my children. So, and then people who have dental appliances like braces might find a powered toothbrush easier to use. When and how often should I floss? So the American Dental Association, the ADA, recommends brushing twice a day, and flossing once a day. When? As long as you do once a day, it doesn't matter what your personal preference is. Personally, I like in the night. There are people that I know that love flossing their teeth first thing in the morning. Some people, I've seen my colleagues and peers brush after lunch. Doesn't matter, brush at least once a day so you've tried to clear the food particles from between the teeth once a day. How often should I get my teeth cleaned? Now the American Dental Association recommends that you visit your dentist at least once a year and to get a routine exam and cleaning. Now, even once a year. For children, the recommendation can be different. So what I recommend is go with the recommendations made by your personal dentist, because they are looking at your oral health, your disease. Do you have periodontal disease? If you have healthy teeth, are you at prone for caries? So they'll make a recommendation based on your personal oral health condition. So I would always say go with your dentist and what they're recommending for you. Early detection. Now, remember I said, for the most part, healthy habits, early detection, and then nutrition-rich diet. So let's talk about early detection. Most oral diseases are preventable. Now, if you look at people who have teeth, dentate adults, aged 18 to 64, about 50% have dental coverage. Sad statistic, but it's only 50% who have dental coverage. So of these 50% though, 22.5% did not have a dental visit in the last 12 months. So even though you have dental coverage, people don't go to the dentist. So it's important for you to be your own best advocate for your oral health. Routine preventive services, once you go to the dentist, we do cleaning, which I talked about earlier, talking to your dentist about your exam and your cleaning, and then dental sealants and fluoride treatments. So what are dental sealants? They are a thin protective coating that adheres to the chewing surface of your back teeth. We put them primarily for children for cavity prevention. If you have kids and you've gone to the dentist and they've not had a sealant, ask the dentist about a sealant and they'll make recommendations. Fluoride treatment, dental office treatments for fluoride. They paint a fluoride solution on the tooth or fill a mouth guard with fluoride foam or gel. Again, why? For cavity prevention. Now that I've talked about so much of what you can do, I'm going to hand it off to Dr. Crespo to walk us through the rest of the presentation. Dr. Crespo, you're on.
Thank you. All right, we've covered a lot of ground. We're in the home stretch now. We're going to talk again. This is something else you can be doing for your own oral health, and it's your diet. You're making choices every day, all day about, oh my goodness, oh, the lights just went off here at my office. All right, I'll just keep going. The main recommendations for your diet and dental health are actually similar to what dietary recommendations are for overall health, and that it starts with drinking plenty of water. Water is important to rinse your mouth after you eat foods. It helps to rinse food particles as well. And if you can drink tap water that is fluoridated, that certainly is the best. Limiting the number and type of snacks. Remember that cavity-causing bacteria thrive on sugars, so that if you can choose low sugar and low carbohydrate snacks, those are the best. And it matters how often you're eating. If you're constantly eating and snacking, you're constantly providing fuel to those cavity-causing bacteria. Eating from all of the food groups for sure. As we say in pediatrics, eating the rainbow, making sure you get a good amount of fruit, vegetables, protein, dairy as needed to make sure you're getting all the vitamins and minerals to help keep your enamel strong, and avoiding sugary beverages and sweet treats. These are not a never. We're talking today in generalities and moderation, but of course, eating less sugary beverage, drinking less sugary beverages and sweet foods is better for your oral health. This is a wonderful slide from the American Dental Association that talks about the foods that actually can damage your teeth. Starting there on the upper left-hand corner with hard candy. Hard candies of all types basically have a slow release of sugar into your oral cavity that again helps those cavity-causing bacteria do their unfortunate work on your teeth. So limiting your exposure to hard candies is better for your oral health. I am a fan of cold liquids. I enjoy ice in everything that I drink as much as possible. The bigger problem is people who crunch ice with their teeth, so avoiding really crunching that ice. Citrus products, and mostly here we're talking about orange juice, lemonade, things that are acidic by nature because citrus products contain citric acid, but if they have sugar in combination, that also is not great for your enamel. Coffee, which again, we're not telling you can't drink coffee. Just remember that coffee is acidic. If you mix in sugar to that, that's that unfortunate combination of acid and sugar in your mouth. And if you have cavity-causing bacteria, they'll feast on that. Sticky foods. This is something that we find people of all ages, but it seems like children really enjoy sticky foods like gummy snacks, and families I know that oftentimes use gummy vitamins or even gummy melatonin. I have many of my families use that for their children. Is to remember that all sticky foods obviously can get caught in the crevices in your teeth, especially in your molars where there's pits and fissures, so kind of those grooves where these foods can stay and really require extra attention with brushing. Things that go crunch, here is pictured potato chips, but actually I want to even mention popcorn. There are many people who have the habit of trying to eat those unpopped kernels, otherwise known as old maids. Those are terrible for your teeth, so try to avoid that. In the next few boxes here, I actually group sodas and sports drinks almost together. Both have very high amounts of sugar in them, and many sodas, all different brands, really have a very low pH, so they're very acidic. These are terrible for the conditions we're already talking about in the mouth. And then alcohol, as Dr. Nina has already mentioned, in moderation, excess alcohol has definitely been linked to cancers in the oral cavity. And then medical dental integration. This is what we're talking about today, is how your doctor and your dentist working together for your health. So there is, again, a growing partnership, a growing recognition that we need to work together for patients. And how might you see this? If you've been to the dentist recently, you may have had your blood pressure measured there. There are certain groups of adults who either avoid going to the doctor and or feel like they're healthy and don't need to go to the doctor. Well, at least if you're getting your regular dental visits, someone can be screening you for high blood pressure, which sometimes has no other symptoms. And only when someone measures it are you then aware that your blood pressure is high. And a dental provider may refer you to a physician to either confirm that diagnosis and or do further investigation. We know there are studies showing that good and timely dental care has positive effects on chronic medical conditions. So again, this connection is there. And then in the future, there may even be opportunities to get vaccines in your dental office. And in some states, there's even allowed today, including influenza vaccines, the human papillomavirus vaccine, and even COVID-19 vaccines. And really this last slide is really just to highlight the medical dental partnership, that there are dental issues that can be found at your dental visit. I'm sorry, that there are medical issues that can be found at your dental visit that can highlight you to problems that you might not be aware of. And these are just a few examples. I will tell you that in my practice, I have seen patients come to me after being at a dental visit and say, the dentist said, little Johnny's tonsils are too big. What should we do about that? And we'll have a conversation, and sometimes it does need more investigation or referrals. So again, having those routine visits, having a good relationship with your dental provider, getting that oral exam every time that you go is just so important. So now I'm going to kick it back to our moderator as we try to get to the question and answer. Oh my gosh. Okay. And here's the message we want you to get today. So your oral health is key to your overall health. Cassie, take it away.
Thank you, Dr. Eileen, and thank you, Dr. Nina. Now we will open it up to questions. Keep in mind that if we don't get to your question, there will be a survey at the end, and you can ask additional questions there. And just remember to include your email address when you do ask that question, just so that we have somebody to respond to. So with that, I will start with the first question. So first question, is there any scientific evidence that autoimmune disease is possibly linked to overall health or oral health?
I'm happy to take that one if you'd like. Thanks, Cassie. That's a good question, especially since the last couple of years, we've heard a lot about the immune system and how it protects us and what it's been associated with the COVID pandemic. Well, autoimmune disorders, for those of you that may not know, it's our immune system working against our own cells, and they can really, in effect, impact our oral health and our overall health. So the main focus on this, since oral and systemic disease is associated, is the fact that we can pick up autoimmune diseases on examination early in the oral cavity and refer to the appropriate physician for management. For example, I can give you some examples that are easy to think of. Sjogren's syndrome is a dry mouth and eye problems that the dentist can see and help get that worked up. Systemic lupus is another autoimmune disease that we see oral findings that we can associate with the disease and get them referred. Pemphigus, another one of these diseases with ulcers that you'll see. Behçet's syndrome, another ulcerative disease. Your dentist can see these ulcers also in Crohn's disease. All these are autoimmune diseases that your dentist may see the first signs, and then he can send you over to the medical providers. And then lastly, oral lichen planus, rather common, very common autoimmune disease. See it all the time as an oral surgeon, and we help patients with this particular disorder. Now, on the other side of the coin, there are problems with chronic periodontal disease and inflammation. I think that Dr. Nina and Dr. Eileen mentioned that really well. There are some indications that chronic inflammatory process like periodontal disease in the mouth for many years may indeed incite a patient to develop some autoimmune disorders. However, that's not as strong an association as what I previously talked about, looking at the findings that we find from autoimmune disorders. I hope this helps. And if anything is needed, just let me know. I'm glad to follow up with you. Thank you.
Thank you, Dr. Templeton. Next question, can I use fluoride toothpaste on my kids, even if they have a tendency to swallow the toothpaste?
I'm going to take this one, Dr. Nina, and I'm sure you want to add in. Thank you so much for this question. Actually, I forgot to mention this on the slide, but yes, you should be using fluoride toothpaste on your child, even as young as 6 months of age. They will swallow it. And so the recommendation is to use a tiny, tiny amount. We say use the size of 1 grain of rice. So just a tiny little smear, because we know that young children will not be spitting it out. So that tiny amount is fine for them. And again, making sure that's happening twice a day, every day. At 3 years of age and older, they can use a pea-sized amount. So you can increase it just a bit then. 3 and 4-year-olds are a little bit better. They're learning how to spit out things. So they don't necessarily always swallow it. But thank you so much for that question. Dr. Nina, did you want to say anything on this topic?
No, I think you covered it exactly what I would have said. So perfect. Thank you.
Thank you, Dr. Crespo. Next question, does an oral irrigator replace flossing?
Dr. Templeton, I can take that. I don't know if it replaces it. I've used it. It's an addition to your oral health habits, but I don't know if I would say replace is a good word. I think you can use both. Dr. Templeton, do you want to add anything more?
Well, I think you're correct, but we're getting better with oral irrigators, and what we're I think going to see your dentists and the hygienists talking to you about interdental cleaners. Floss has been the gold standard, and it works really well and it's inexpensive. But some of these are getting better. The technology is getting better. So keep your eyes out. Talk to your dentist and hygienist for interdental cleaning devices. However, I agree, floss is still our gold standard and go-to inexpensive way to once a day clean between our teeth. Thank you.
Thank you. Next question, and this was asked, Dr. Crespo, when you were kind of listing out those things that are not so great for your teeth. And that is, are seltzer waters and diet soda also bad for your teeth?
Great question. I think people feel like, well, you know, if it doesn't contain sugar, then it probably can't be bad. But unfortunately, seltzer water and diet soda have low pHs, so they're acidic, and that isn't great for your teeth either. Is it better than a regular soda full of sugar? Yes. But again, I think we have many people who drink many cans of LaCroix water and think, well, this is fine. It's not going to cause any problems, but it still has a lower pH for your teeth. And for sure, you should at least be drinking water afterwards, regular plain water, not seltzer water, to just rinse your mouth from everything that you've already had. If anybody has anything else to add, Dr. Nina or Dr. T?
Yeah, I think carbonated, less carbonated, the better. Love the water after. Dr. Crespo told me I'm cutting edge right now because I'm drinking coconut water. That's what I grew up with in India. So coconut water is right now my favorite. So it's go-to for me right now. But, you know, there's things that you can go to, but everything is moderation is, I think, the gold standard.
So one more question on that topic. So what about things that you mix into your water, like Crystal Light, that type of thing? Can you do that?
Yeah, from a preference perspective, carbonated is less preferable than something that you mix in your water that's non-carbonated. However, the sugar content is something you have to always be aware of. So just be aware of the sugar content if you're drinking things that still have sugar in them.
I'll also say one last thing. Many of those, some of those mix-ins can be lemonade flavored. And again, that goes back to the citric acid and makes them more acidic. So you just can't win. There's just nothing better than just plain water.
So next question, with so many teeth whitening options, what are your recommendations? What is your recommendation for teeth whitening?
Oh, that's a tricky question because I'm not a big fan of it personally for myself. So, but it's not, I would always start with, before you go down the path of wanting to do things yourself, talk to your dentist, because there's always, that's the best recommendation. And the reason I say that is you never know that if you have an active decayed tooth in there and you're starting to use some of these over-the-counter whitening products, and then you may start to see sensitive, or you're grinding your teeth and the teeth become more sensitive because you're now starting to use some of these whitening products. But Dr. Templeton, would you have anything more to add?
Oh, simply the same. Talk with your dental professionals to get advice. The over-the-counter, the treatments are quite good, some of them, and some of them are rather disruptive to your gums and your tissues. So you have to be careful, but it's basically combinations of either hydrogen peroxide or carbamide peroxide, and it bleaches the teeth. That's the bleaching part. The other is the abrasive whitening device, and your dentist needs to know what you're using because it affects your dental condition and your gum condition. Thank you.
Thank you. Next question. What is the recommended age for a child's first dental visit?
So, yep, Dr. T is showing us, and maybe I didn't stress it enough in that slide. So it's a dental visit by age 1. So I start talking to my families at 9 months and say, it's time to start scheduling your child's first dental visit. Hopefully it will be a quick visit. Usually it's very introductory. So they'll have the child sit on your lap. They're not going to have to sit in the chair by themselves. Oftentimes, dental providers will do a knee-to-knee exam. So your child, that will help kind of manage your child's, anxiety. Some kids do great with it. Some kids are not fans, but it just gets them into the routine of getting to that dentist and getting that important early information and assessment of the oral cavity. I definitely, Dr. Nina and Dr. T, if you have anything else to add.
Perfect. Next question. Can a person have a periodontal disease or gum disease complications after their teeth are removed?
So, Dr. T, you want to take that?
Well, that's an interesting question. I think I understood it, but once the teeth are removed, there's no periodontal disease or caries. However, I must tell you, you're not out of the woods, because when we place the implants, you can get peri-implantitis, which is a cousin of periodontitis. And we've actually seen in our patient populations the history of periodontal disease in the mouth and maybe some teeth left and some implants placed, you might have an increased risk in peri-implantitis. Be careful, talk with your dental professionals, and follow through with regular care. Thank you.
One thing to add to that is you may not have periodontal disease or gum disease, but you may still have oral disease, meaning you may have other oral health issues that may arise as you're losing your teeth. So you should still be going to your dentist, having them check your dentures if you're wearing dentures at least once a year, have routine care that way still.
So next question, why are other countries more prominent? Why is oral cancer more prominent in other countries? Is it because of more smoking, less fluoride in the water? Any insights on that?
I have insights. I was born and raised in India, so I have some insights on that. I went to dental school in India as well as in this country. And I can tell you the incidence of oral cancers is because of tobacco chewing. That's the number one. There are people that sit with tobacco in their mouth half of their day. So that's number one. The number two that you see is there's smoking that occurs, but it's smoking with cigarettes with no filters. That was one of the leading causes. So they have those that are actually more harmful. And then they roll tobacco by themselves and smoke. So it's all of these habits that are primarily linked to tobacco chewing, tobacco smoking. Not fluoride, not necessarily, maybe more oral disease, but not cancers as much.
Might add betel nut chewing.
Yes.
People in some countries chew betel nuts, and that leads to cancer and a disease we call submucosal fibrosis. Thank you.
Yes, forgot about that, Dr. Templeton.
So it's 12:44, so I'm going to ask one more question, and then we're going to end the webinar. I think we got to most of the questions, and thank you for your engagement throughout. Really appreciate it. The last question, are there any kinds of mouthwash that should be avoided?
I want to say, look out for the Power of Smile blog, because this is a quick, it's a topic that has a lot of content in it. And we are working on actually writing about mouthwashes in the next month or so. So I would say look for that content on the Power of Smile blog. There's an article coming up on mouthwashes. I think my biggest thing is, as much as possible, avoid the mouthwashes that have alcohol in them. And Dr. Templeton, for a short thing, do you want to add anything, Dr. Crespa?
I have nothing to add except I'll put a plug in for ADA approved mouthwashes are a good idea.
Yes.
I would say there are fluoride mouthwashes for children that can be very, very helpful, but you have to be sure your child can spit it out. We don't want that, it's too much fluoride exposure for them. So just beware that you're not using that type of product with a child who's going to swallow it all.
But look out for the article on the Power of Smile blog. It's coming up.
Thank you for the plug, Dr. Nina. Thank you, Dr. Nina, Dr. Eileen, Dr. Templeton for your time today. Really, really appreciate it. And thank you for everyone that attended today's webinar. Please remember to take the survey at the end. It's automatically going to be sent to you when you log out of the Zoom. And as I mentioned earlier, there will also be a spot for additional questions that you might have for our clinicians. Please remember to include your website address and we'll make sure that we get to those. And also there's a link to the Power of Smile blog, which we've been talking about, which is located on our website and gives you additional oral health information. So I want to thank you again for attending and have a great day.